What I admire most about my dad is he was always a selfless person. He always put others before himself. He always showed courage. He always had a bigger picture in mind. He knew he wasn't going to make it, but he wanted to leave a lasting impact on me and my brothers and on others.
He went to play in a tennis tournament one day and had some vision problems. So decided to go have that checked out. And in the course of those exams, they found a brain tumor.
At that time, it was a stage 2 tumor, and I had my first surgery with Dr. Lang, and felt great after the surgery, and kind of went on about my life as normal.
And then about 11 months later, the tumor recurred again.
At that point in time, unfortunately, we found out that it had progressed to grade 4, which is known as a glioblastoma.
Late in his treatment, he got a stroke and had to relearn how to walk. And on the weekends, there was dog therapy. And even though it was painful, my dad would try to take a few steps in front of me and my brothers just so we wouldn't worry about him.
I'm not in denial. I just don't focus on it as far as my day-to-day activities.
Seeing and hearing about all the problems that my dad had to go through and the selflessness he showed through everything really gives me the strength and courage to go through everything that I might have to go through.
Even while he was suffering, even while he was going through treatment, even while he was battling, during the hardest time in his life, his main objective was to make others around him feel normal.
Having a very serious illness will put a lot of things in perspective. I want, what's best for my family and foundation naturally, and I want to do well at work, but not at the expense of other people.
It's one of the things I always really loved about him was that he could identify a problem, but he didn't stop there. He was able to identify a solution and really find a way that he could be a part of making a difference. So he was able to do that with the foundation and with brain cancer research.
I'd rather, do good things for my family and for this foundation and, help MD Anderson, find a cure for cancer.
The Broach Foundation was created to carry those values forward, advancing the prevention, treatment, and cure of brain cancer, and supporting the researchers to advance the field forward.
James was actually, he was an unusual case. He was actually diagnosed with what we initially thought was a lower grade glioma, but we do know that those can progress and ultimately become glioblastoma. And unfortunately, his actually did that at a faster pace than we were expecting. He faced all of those challenges head on. I don't think I ever heard him complain.
It does have a negative impact on the population because the mortality rates are severe, and they really haven't changed over the last 2 decades, especially for the grade 4 type like I have. And so that's what we're trying to do.
Glioblastoma has vexed surgeons, scientists for many, many years.
We realized early on with our first clinical trial, and we were seeing people living over 3 years with eradication of their tumor.
A lot of the immunotherapy studies for glioblastoma have struggled because these tumors are immunologically quite suppressive or immunosuppressive. Much of the work that is being done now is aimed at understanding why these tumors are so immunosuppressive and what is the different cell populations that comprise these tumors and how that can be targeted therapeutically.
The oncolytic virus, which is called Delta 24, it actually causes a common cold. But we engineered it so that it would kill tumor cells and not kill normal cells. And we also engineered that so that it can get into tumor cells better than normal cells. The trial we're doing now expands on that, but actually delivers the virus through the bloodstream. The best way to deliver this was not through the vein intravenously, but actually to use an intra-arterial approach. So we load the virus into this carrier cell called a mesenchymal stem cell. And then it turns out that this mesenchymal stem cell actually homes into brain tumors. So therefore, when it gets into the tumor, it can release the virus into the tumor. It suggested to us that this agent had the potential to potentially cure brain tumors. So this combination of the virus, Delta 24, plus the cell carrier, the mesenchymal stem cells, plus intra-arterial delivery makes this one of the most unique trials that we've ever done in our brain tumor at MD Anderson Cancer Center. It's actually become an entirely new field called endovascular neurosurgical oncology.
As we understand more of the biology and genetics of gliomas, we're starting to understand ways that we can potentially tackle these tumors.
Many cancers from the body actually metastasize to the brain.
And when we think of brain metastases, we're not thinking about one tumor histology, we're thinking about all the potential tumors that go to the brain.
So lung cancer goes to the brain, colon cancer goes to the brain, breast cancer goes to the brain. It actually turns out that many of those cancers are actually curable, except when they go to the brain. So the brain remains sort of a sanctuary and the final endpoint, unfortunately, for many people.
We're really viewing the brain as an anatomic site where we can treat multiple different types of tumors. Over the next 10, 20 years, the treatment options for patients with tumors arising in the brain, whether primary or metastatic tumors, is likely to be revolutionized.
Scott came to us with a glioblastoma. He had been treated with standard of care and it had failed. When he came to us, he already had had multiple treatments, he already had had surgery, and he was looking for alternative strategy.
I had my first craniotomy. That was done in October of 2019. Everything was going well, and then they found something else.
James and Scott do have similarities. Scott is always optimistic. Again, I don't think I've heard him complain. So we presented him with our clinical trial of the mesenchymal stem cells carrying the Delta 24 and delivered intra-arterially.
And when I met Dr. Lang, for me, I felt so safe.
I think at about 9 or 10 months into the treatment, we saw a new dot. And I gotta say, I thought the therapy had failed.
Dr. Lang had told me that they had found another spot.
And quite interestingly, when we took out that lesion, there was no tumor there. And you say, well, what does that mean? Well, what we think was happening was that a tumor was in fact forming, but now we had educated his immune system to find any new tumor.
You know, I met with Dr. Lang and he let me know that it wasn't cancer. You just think, well, I mean, wow.
We have actually vaccinated him in some ways against his own tumor.
I'm still here. Like, that's what matters to me.
Over time, the lesion that we treated actually has completely shrunk away. So he is what we would call a complete response.
I remember figuring out that when you have the type of cancer that I have, they tell you, maybe you have a year, maybe. Scott, get your stuff together, right? I've been doing this for 6 years, plus 6 years, and Dr. Lang is the one that has been able to keep me moving, to help me take care of my family, and that's what matters to me.
Cases like Scott really started to convince us that this could be a long-term treatment. Our strategy actually has the potential to only kill the tumor cells and not kill the normal cells, so that the brain could, in theory, recover.
I hope there are other people like me, many other people like me that are going to be able to experience what I have been feeling for the past, 3+ more than years. I hope other people see, if they see anything about me, they should know that there is hope for them to move forward, right? And that's, if there's anything, that's what I want
people to know is that there is hope, and they should just keep moving forward.
I think we're going to be able to provide patients with a wider array of treatment options. We'll have a greater understanding of how the tumors that patients have and the treatments that we're giving interact with the greater nervous system.
I don't feel like I have brain cancer. I feel fine, and so I think I think this strength comes from not having a choice.
My dad believed how important this mission is, and it really is. What Dr. Lang and his team is trying to do, it really will change the world. And my dad truly believed that, and we all truly believe that as well.
Because of this research, what once felt impossible is starting to feel within reach. For families like Scott's, James, and others, the Broach Foundation is committed to the research of Dr. Lang and MD Anderson because progress is happening.
We are truly at a unique time in the history of oncology with profound potential before us to achieve our mission to end cancer. Immunotherapy, once thought impossible for brain tumors due to treatment resistance, is now beginning to show promise through groundbreaking multidisciplinary efforts. The sustained commitment from all those who support the Broach Foundation shows families facing brain cancer that no one fights alone.
When my father started the Broach Foundation, he adopted the motto, "No one fights alone." We all wore these bracelets, these gray bracelets that say, "No one fights alone."
No one fights alone. No one fights alone.
No one fights alone.
No one fights alone.
No one fights alone.
No one fights alone.
No one fights alone.
I remember that. No one fights alone.